So she lost that filter, that impulse control. Remember that the front of your brain? That's starting to go, right? She's clearly not hesitant on the things she says anymore, right?
She's not remembering things that she had done. She didn't remember drinking the coffee. She didn't remember using all the toilet paper or hiding the rest in the closet.
Yeah, so she's not remembering things that she normally, the things that she did. She can't recall them, right? What else?
People are coming and taking stuff.
Yep, so she had some, you could possibly call it delusions, or even, which isn't necessarily a guarantee with dementia, or even just the sense of like, well, obviously I didn't do this, right? What else happened? How well did she do when she saw things? Did that visual cue her? Did that remind her?
Mm-mm.
She didn't even think that she put that toilet paper
No.
when she went to go put.
So that ability to visually recognize something kind of went, that wasn't enough of a cue for her, right? Anything else? So,
Remembering she talked to her friend.
yep, she couldn't remember she talked to her friend at all. Kind of thought maybe it was her fault.
Yeah,
She
she's
called.
kind of like in denial, like
Mhm.
turning it around on her friend. Like, oh, you're the one who's forgetting stuff. When really it's her.
And do you think she knew who she was talking to?
Mm-mm.
Probably. Well, but the first time it kind of sounded like, and she's like, oh yeah, the vacation pictures.
So at one point in the
Yeah.
conversation she did.
Like, oh yeah, you're that one.
Mm-hmm. How'd she do finding words and nouns? Just descriptors.
Well, she called the coconut brown hairy balls. Which is really bad.
So not so good, right?
Yeah.
She described the coconut as a brown hairy ball because that ability to recognize that word was gone, right? That noun. That's typically what we see. Nouns go first. Nouns, so your names of things, your descriptors. So how comfortable are you guys on a scale of 1 to 10 knowing if it's normal or not?
Six, I would say. Sometimes it's hard to, until you get more information, whether it's normal aging process or if it's more intense. You have to spend a little bit more time with them to be able to make that determination.
So what are the things that we need to look for? What would help you to say, this is normal?
Well, like you said, that they're losing their, not utilizing the nouns anymore. Their
Yep, so loss of nouns again.
descriptions of things.
Yep.
Or not being able to recall things at all, even with visuals, which is your primary.
Mm-hmm. Anybody else? How comfortable are you guys from 1 to 10? A 5 or 6? So what are, she talked a little bit about some of the things that she'd look for. What are some of the things that you would look for? What's something that would help you be like, this is not normal?
They're forgetting things and they're repeating things, or like getting agitated over stuff that they did that they don't think they did.
Okay, so looking a little more at their behavior.
Right.
That agitation of like, she had shown, my son's not listening to me, he thinks I'm nuts. I told him they're coming in here and stealing stuff because she can't remember. Right. Or that repetition, because they forgot they told you.
The no filter is another one.
The no filter is huge. Yep, you're starting to lose that portion of your brain, so that I think naturally we see that a little bit as people age anyway, but when it's really gone, that's
More
an indication
pronounced.
that something's not, more pronounced. Something's not right. Good. They typically believe that individuals go back to when they have dementia. What era of their life they're living in?
The younger one?
Hmm?
The younger.
So you're thinking younger, you're thinking adolescent. Why adolescents?
because that's probably when their brain is really starting to adapt and learn all these things, and that's what stuck with them.
That's definitely a good thought, and I would think things like trauma would also affect that. What do you notice that people with dementia often talk about? What are they looking for?
Their parents.
Their parents,
Their wife or girlfriend.
or their spouse, significant other. What else? Where are they usually trying to go?
Their home.
Home or work? And who else besides their spouse and their parents are they looking for typically? Sometimes siblings, children. So about when in your life are you gonna have your parents, your spouse, your children, and a job? Middle age. Typically about the 30s. So we're thinking that about the 30s is where people kind of land. You know, obviously as it progresses and they move beyond that, they'll progress more and more to an infantile physical capabilities, but their mental capabilities for some reason end up around their 30s.
Almost immobilized, right?
What to talk about is that just because it's not normal, does that mean it's dementia? No. People will present with things that are clearly not normal, but it's not dementia. What can cause that?
Stroke.
A stroke, so acute illnesses. Yep. What else? What causes people to seem like they have dementia, not normal?
Infection.
An infection. That's huge. What else?
Brain injury.
Yep, so a brain injury would be sort of an acute illness. Yep. What else? What did we talk about with words earlier today? 1 in 4 are gone. What do a lot of our residents experience here in terms of hearing?
Loss.
Hearing loss. Yeah. So sometimes we think people are just like not with it. They can't hear you.
Some of them have selective hearing.
What?
Some have selective hearing.
Some have selective hearing, yeah, that happens. But if they can't hear you, that doesn't help, right? They can't accomplish what you're asking them to accomplish if they can't hear you. It's interesting because 2 of these are never brought up in here. What about stress? How many times have you been in a stressful situation and you're just not up to par? Right, that can look, so a lot of our rehab patients maybe coming in, they can look like maybe there's something not right here. What are 2 huge things that we deal with on a daily basis? Don't feel bad, you're not gonna be the first class who hasn't brought these up. What did you talk about before? What's important for someone to know about you?
Pain.
Pain. Pain is huge. Huge. And what else do we push on people all day long? Medications. Yep, so those are 2 huge ones that can cause people to appear like there's something not normal going on, but can be fixed. So I want the 3 of you to talk a little bit about 2 things you learned that are normal, that you didn't know were normal. And I want the 4 of you, did I say 2 or 3? 3. Okay, the 3 of you to talk about 2 things that you learned today that are normal, that you didn't know. And then the 4 of you to talk about things that are not normal, that you didn't know. So just take a minute and talk to each other about that.
And you do, that I do a good job, and then maybe having to go back to her room an hour or 2 later, and then all of a sudden, she's very irritated. To the point where she doesn't even wanna talk to you, as if she doesn't even really recognize who you are from when you were in there earlier.
So that, maybe that drastic mood change. You know, one of the, and not being able to recognize you, one of the beautiful things I learned years ago is that you can negatively affect someone with dementia, and they can be affected emotionally for days, but not remember why. So a very easy example of that is their spouse passes away, we tell them their spouse passes away, They don't really even remember who their spouse is at the moment. They're sad because you just told them someone passed away. 3 days later, they're still sad, not a clue why, right? They lost that. So that's really depressing. I mean, we can negatively affect someone for days and not even know why. But the beauty is the opposite. We have the ability to make moments with them of joy and of happiness, and that can carry on. They won't remember you, or they may not remember you, but they'll remember that they're happy and they're loved. So I think that's a really, really beautiful and empowering thing to know, that you can make such a huge difference. But yes, in not normal situations, that changes. In 5 minutes, that can change. Yep. Good. All right. Does anybody have any questions about the normal versus not normal, or anything you want to discuss with that? Okay. So what we're going to do now is actually go into the gems. So what I want you to do is you're going to be looking at the next sheet of paper. That sheet of paper, I would hope that you would keep. I hope that you put it in your pocket. I would hope that you would utilize it. Read it and utilize it. So what I'm going to do is I'm going to give you guys about a minute to just quietly by yourself read those. Just read them, look at them. If you prefer not to look at them on paper, remember you have those gems cards, so you can take those gems cards out and just kind of look at those. Yeah. Everybody's different, so whatever it is that you prefer is fine. So I'll get, like I said, I'll give you guys about a minute to go over that. What do you notice when you're looking at them? They're all different. Yep, every one of them is different. What else do you notice about the gems? What do you think they are?
Jewels.
Different stages. Yep, we're looking at different states of dementia, right? They're jewels. So what do we know about jewels, Jen? What do people consider jewels in society? Precious.
Yes.
What else? So they're precious, but what else are they? Rare. Unique, right? So why gems? What is it? Why were they created? Why would we be talking about these? Some are harder than others, yeah. Yep. So we're looking at kind of the differences between them. But why else would we be talking about gems? Why is this a classification?
Because they're valuable.
Because they're valuable and they're unique
And colorful.
and they're colorful and they're beautiful and they're not confusing. Is anybody familiar with any other ways to describe dementia besides gems? What other ways do we use to describe it?
Like stages.
So what would you say to someone? Your mom is end stage, early, middle, late, end, right? That's one way we classify it. There's also a little bit older systems of number systems. One was a 1 to 7, 7 being the worst. One was a 7 to 1, 1 being the worst. How confusing is that? And how many of you would want to go to the doctor and leave being like, I'm a number 7? But what if instead of being a 7, you were a diamond or a pearl? Right? So how is that different? How does that make a difference in what we do? Gems versus non-gems.
Kind of to feel better about yourself then. Like if you're a diamond instead of a number.
Right, it feels better.
Yeah.
It's more dignified. And I'm not normally one of those fluffy, like we've gotta fluff everything up and dignify it. But I think you'll also notice that this also matters, and this is also different because we're looking at abilities. Did anybody notice that? When you're reading them?
Mhm.
We're looking at what does someone have left, not what does this mean for their loss? Where are they in terms of loss? But what do they have left? What is still helpful? What is still going to be effective? So what we're gonna do now is just watch a 12-minute video on this, and then we're gonna talk a little bit more about it, okay? Hopefully it's the right volume.
Grammarly does.
So, what did you guys notice about that? How did that make you feel? I'm gonna make you guys do jumping jacks.
It makes you look at the resident more closely with a lot more awareness on how you can relate to that resident as well as treat that resident so that that resident can be as close to normal for them as possible.
Right, so it helps you to kind of identify some things, to work with them and to help them, right?
Mhm.
Anything else on the video itself or on Jim's? So what we're gonna do now is I'm gonna give you 3 or 4 minutes, and what I want you to do is the next sheet that you have, you can tear that sheet out if you wanna use it. The next sheet that you have, I want you to fill that out on your own for the next 3 or 4 minutes, okay? So look at who do you believe is in each of those categories, and then why? So who is it that's all of those gems? Why are those gems? And I'll give you until about 10 to.